I'm Teresa Morrow. I'm Program Director for Women Against Prostate Cancer, and we work closely with Men's Health Network, Scott and Richard here. So
Great. Yeah. And I'm Scott Williams. I'm the Vice President of Professional Relations and Public Policy for Men's Health Network, and very excited to be with you guys here on the Healthy People 2020 effort. I know back in 2010, it was a fantastic dialogue that we had around addressing gender disparities, and I'm very excited to once again explore that area and just see what additional areas we might need to address for 2020. So thank you guys for your time and efforts.
You're welcome. I'm Penny Royal, and I direct the Office of Disease Prevention and Health Promotion at HHS.
I'm Carter Blakey. I'm a senior advisor and the lead for what we call the Community Strategies team at ODPHP.
I'm Deb Nichols. I'm a public health advisor and a physician, and I work on the Community Strategies team on Healthy People projects.
Great. Well, thank you all for taking the time out to speak with us today. First question I have is, what best practices have you gathered or witnessed from the implementation of the goal to eliminate gender disparities in Healthy People 2010?
Well, I think the first thing we can say is because of that goal, there has been more analysis of gender information. Up until that time, there wasn't as much calling out of the differences in men and women, and I think that's been a very positive result of that objective.
And what more could have been done to meet this goal?
Well, I think there can always be better data collection, surveillance, and collection of the data we get from surveillance is never enough. We can always know more, and especially in some of the subpopulation groups. We need to collect data by sex on a very consistent basis. Mm-hmm. And I think we're doing better, and we'll continue to do better in the future.
And I know in a lot of our work that we've done on different partnerships and collaborations with both the NIH Office of Women's Health Research, but also with Wanda Jones and the Office of Women's Health, they've always been fantastic about sharing the most recent current data that they have, so that we can spread the word. Because for us, it's more about healthy families. We know that men aren't going to get to where they need to be unless we have the women there. You guys are the healthcare leaders in the household, so it's really the buy-in from all the stakeholders in the family to better both of the situations. So both of those partners from the government level have been fantastic in terms of sharing information and collaborating on a healthy family project.
Wanda Jones has been a very strong advocate for gender health. Yeah. And even though she is the Deputy Assistant Secretary for the Office of Women's Health, she is very aware and very inclusive and believes strongly that gender health is the issue. Mm-hmm. And she's been very supportive of you and all of your issues.
And you mentioned best practices, but perhaps a best strategy is just what you said, partnerships.
Yes.
I think that really is the key to improving not just disparities across between the genders, but all disparities. So I think groups like the Men's Health Group, partnering with different agencies at HHS or outside of HHS and even other organizations outside of the federal government to push the Healthy People goals forward. I think that's the key to moving things.
I like the idea of groups working together and finding areas of commonality. I think that's really the spirit of 2020. How can we work together to find common issues that we can advance, as opposed to, oh, let me save my piece of the pie. I think it's that kind of sharing of information and knowledge and professionalism that's really important.
Okay. So I guess you guys have addressed this somewhat, but looking forward to Healthy People 2020, do you feel that gender disparities will still need to be addressed? And if so, what additional opportunities to do so do you see?
Well, I'd just say that we've already seen the draft overarching goals from the advisory committee. Mm-hmm. So we don't know what the final goals will look like, but disparities is included in that. And I can't imagine that we would stray too far from what we did with Healthy People 2010. We had our minimum template for each of the objectives, the population template, mm-hmm. and gender is one of the entries in that template. So I would be very surprised if gender weren't included still, because there's data collected by gender, by sex. So I would imagine looking forward that gender differences would still be measured. I'd be surprised if they weren't.
It's not going away.
Yeah.
You can be pretty sure women are not small men. Men are not big women.
Right.
There are biological differences as well as cultural differences. You just said a few moments ago that the women seem to be the gatekeeper as far as the family's health. And I think that's a big cultural difference, and explains some of the disparities in the health status of women and men.
Mm-hmm. And I know looking at a lot of the proceedings today and hearing the public comment at the end from the employer groups was especially interesting to me, because a lot of the programs in health outreach we try and set up, we try to reach men where they live, where they work, where they play, and where they pray. So trying to set up programs like that that'll hit them in each of those different segments, and trying to figure out, how do we find that common ground even with the employers, and how best to bring in you all on the federal government side to help addressing kind of a triangle approach to bring all the stakeholders together at the table, because it seems like everyone's interested in the same goals and objectives, but how can we work together on a consistent basis to make it work? And I think Healthy People 2020, at least for us, was going to provide us the framework to do it, I think.
Well, we think so too.